Hi everyone, Dan Julian here, nurse practitioner for Danesthetics Medical, and our clinic is located here in Ottawa, Canada. Today I'm happy to share with you an updated version on how I treat the temples using dermal fillers. I've learned this technique from 2 different providers this year. I've implemented it into my practice, and I have to say the results are pretty great. So that's what I do, share with you guys everything that I've learned for free. Enjoy it. I think you guys are gonna love it. Alright, so before I do any type of injections, I need to make sure that I have a sound understanding of the anatomy, which means arterial location and depth, and also what's going on under the skin. So let's help us out here with our assistant Sarah. Say, hey Sarah, and I've highlighted the temporal zone. So this is the temporal crest, which is this little line right here that you can feel the bone, the orbital rim, and also the upper zygoma. This area is the temple region, the entire temple region that I want to address and make sure it looks seamless. And then after that, I want to identify exactly where these arteries are. There are 3 arteries that you need to know about, especially this first one, which is the superficial temporal artery. It's the largest one, and it connects right to the supratrochlear artery, which means that if you get filler in there, you could potentially blind someone because it can be pushed all the way into the orbit. So be mindful of that. Now with the deep temporal arteries, you have 2 of them, an anterior and posterior one that runs deep. And what's really important is to understand that the deepest temporal artery usually runs posterior or behind this orbital rim, here, by 1.8 centimeters. So that means this area is usually avascular or there's no arteries associated there. However, that said, we're using a lot more ultrasounds now, and we're noticing that sometimes these arteries do vary a bit, so be careful. I do use an ultrasound whenever I'm doing the temple just to make sure that I have additional measures of safety. Keep that in mind. All right, so now that you have an understanding of the arteries, you need to understand what layers lie underneath the skin. You have superficial fat pads. Underneath that, you have 2 very, very small layers of fascia. And then underneath that, you have muscle. And then underneath that, you have bone. Now that we have our anatomy all set up and we're good to go, let's bring back Sarah and let's talk about our first technique. The first technique is going to be the shotgun injection technique. And this is where I go up this temporal crest by 1 centimeter and I go down 1 centimeter and X marks the spot. This is where I'm going to place my first bolus. And what I'm going to do is I'm going to make sure I'm on the bone. I'm not pushing too hard, just hard enough to make sure that I'm on the bone. Aspirate, I do hold for 10 seconds, or I use an ultrasound to identify it's safe, then I don't have to aspirate. And after that, I make my first injection, half syringe usually. This is going to volumize this whole area. So if I'm going deep with a lot of resistance, against the muscle, and I'm using a stiff product, good luck trying to push this down. You can say you have the intention of doing that, but likely it's probably just going to stay here. So how else are we going to treat the rest of the temple area? Well, this is your second injection technique, and this is the new one. This is the one that I learned this year. Prior to that, I was doing this exact technique. However, I was going just underneath the skin. The problem with that is you're going so superficially that even if you're using a thinner product, you're going to see some lumps initially. And by the time it calms down, because it's so superficial, the risk is whenever they lean on their temple and they take their hand off, they're going to have an indentation there because the filler is too superficial. So we've come up with this newer technique, which is called the interfascial technique. And basically you do the exact same thing, but you must use a 22 gauge cannula. You're going to go right underneath the temple crest and you're going to pierce the skin. Once you pierce the skin, you feel the first pop, and that first pop means that you're in the subcutaneous tissue. That's right, you're in the fat pad. You need the second pop. The second pop is going to put you inside that interfascial layer, just right before the muscle. So go in, first pop, second pop, boom. Turn the cannula now down and you go straight down, and you can fill this complete, the rest of the hollowing with the cannula. And I use the same type of product, either a very thin or medium G' filler. So either something in the tear trough or something in the lips. If someone has a little bit thicker skin, go with something a little bit thicker. And if you have someone with very thin skin, go with a thinner product. But generally, this is what you need. I do a half syringe with a bolus and another half syringe with something thinner throughout. And that gives me usually what I need to do a full temple restoration with 1 cc total on each side. Now the fine tuning. How much is too much, and when should you actually fill someone's temples? Well, whenever I'm looking at this whole temple region, right, we have the temple crest, the orbital rim, and the zygoma. I'm looking at these 3 areas as an indicator. If I find the temple crest is too sharp and it drops down too much, then I think I would like to soften that up a little bit. Same thing with the orbital rim. If I find that the orbital rim is too projected and it's too harsh of a transition, then I want to soften that as well. And the same thing with the zygoma. If there's too much of a bone that's prominent and there's a big dip, then maybe I'll soften that as well. Remember that whenever you do anything, you always want to make it look as natural as possible, and you want to like almost under treat just slightly and never overfill to the point of convexity. And also keep in mind the type of filler you're using. If the type of filler that you're using is known to draw in a lot of water, do not treat perfectly, undercorrect, and make sure it gives it time to take in that extra water over the next 6 months. Now, if you've enjoyed this free content, amazing. Thank you for subscribing. Keep going. Remember, I do have a Patreon account where I share all my techniques on actual clients at an affordable price. If that interests you, click the link below. Until next time, take care of yourselves, exercise daily, and please be nice to absolutely everyone.